Okay, this is part 4 of our training video series called Routine Cardiopulmonary Bypass. The cross clamp is on. We're actually in this point giving retrograde cardioplegia. I'm going to go to the cardioplegia module, and you can see we're giving it about 250 a minute in retrograde. So we'll turn it off. We're in sim mode. Now it's off. And we're going to turn this back to antegrade. Now, the learner can get blood gases, ACTs, and those are all, I think, fairly straightforward. If they want to get a blood gas to check it, they can pull this up, check it. It will read exactly the same as the your CDI, your online monitoring. And let me show you a couple other things that can come up. We can also have a temperature and timers that can come up. So if you want a separate thing for timers, because your timer on your heart-lung machine will not match your OR clock. So this will keep you in sync with how fast the case is moving. If you're looking at the timer on your heart-lung machine, it will go much slower if you're using the time factor. And so you can do all those things to stop it. And just set that to 0. Back. And we won't use it right now because it gets a little cluttered. So right now what we're going to do is start to rewarm. So the learner will come over to the heater cooler. We're going to hit warm, and we're at 36, so we go up to 37, and the pump's on, and it should start warming. And those numbers of how long we've been warming or how long has the clamp been off is going to be based on the OR clock versus your own clock that you're looking at. So as we're warming up the patient, we may want to bring up the flow a little bit, although we're already at 2.2 index, or yeah, 2.2 index. Bring it up a little bit. We can kind of keep an eye on our blood gases, but they probably would be okay. They may or may not be okay right now. Looks good. So it looks like the core temperature is around 35.6, 35.7. And the surgeon will say, okay, we can take the cross clamp off. Now remember, if we've got this lever in antegrade or retrograde mode, the cardioplegia category or tab will control it. So pump flow down, clamp off, and we'll come down here on cardiovascular variables, and we're going to see how it jumps down. Now, say for example you wanted to stop there, and maybe you wanted to fibrillate or something. It's going pretty fast. Then you can go back to the cardioplegia module. You can turn it off, and then go back over to the vascular parameters, and maybe you create VFib. And then maybe you want them to defibrillate the heart, and it will go into asystole. And at one point of the operation, whether they spontaneously defibrillate or not, they're probably going to get a pacer. If you let the cardioplegia module run the EKG, it will always stay down here. So if you want to do any of these parameters besides sinus rhythm and asystole, or these values in between, it will you'll need to get out of the antegrade and retrograde mode. Alright, we can see over here in the blood gases that our PCO2's gone up, our PO2's okay, we're warm, we're at 36.9. So let's increase the sweep just a little bit. You can just kind of click on the number rather than trying to slide it. You can just kind of click where you want it to be. And that'll take a minute or two to change. There it comes down. So we're warm. You may want to get another blood gas, right? And the instructor has to be prepared for that, because perhaps the learner may pull that up and may have a high glucose, right? And high potassium. 6 in there. And so when they pull it up, they might see values that are that they may need to treat, depending on what your goal is for the case. Lactate as well. Let's take that away so the learner can get that way. They can move it, or they can just take it off the screen for themselves. And let's look at them a little bit better. Right there. So that looks pretty good. Patient looks good. What we're going to need to do then is come up bypass. So to do that, again we're working with one mouse or one cursor versus two, but we'll be bringing the flow down and filling the patient up slowly. What you have to remember is that now we're going to be going back to scenario mode, because we don't want these blood gases to show up kind of totally inaccurate, because they're not based on both pump flow and patient cardiac output. Let's make this a little bit of a different. We're going to start weaning from bypass. Let's make this a little bit tougher wean. Let's bring this down to 60. And we'll bring this one down, those two. And we'll start bringing our flow down. And you can do it much more balanced than I am, but so you can see CPB is 1, now it's 3, and the pump flow is coming up. Not as fast as you'd like it to when it was at 80. And 6. 11. Oh, I'm going to get down probably about 10. So say we're going to stop at 10. Okay. And now we're off. And the monitor went away. If you look up on the the category here with the gases calculated, etc., the cardiac output's only 2.9, which gives us an index of 1.5 approximately, so very low. And you notice that the SpO2 reflects that, because remember we have the blood chemistry being in the scenario mode. We've got these baseline values up here that won't change. So in this case you might say, well, the pressure's really low, let's get the pressure up. And again, this might be an anesthesia thing, or if you're teaching someone particularly how to manage these patients as an observer, you can say, well, we're going to give some neo. And as a facilitator, you will need to know how these buttons, or how the drugs that the learner is giving will have your patient respond. So they're just giving a straight alpha agonist. You can see the SVR is just going to go up, and that'd be fine and dandy, because the cardiac output doesn't improve at all. So we may want to increase the contractility of the heart by giving them some sort of epi or what such, and we can bring that up. Perhaps we don't like the delivery is really low, and perhaps they want to give some blood, so we could maybe take that up to 32. And it's looking a little bit better. You can look at the SpO2. So at this point, they may take the cannulas out, etc. You could go back up and, you know, they may be giving heparin, so you're watching for those criteria. And we're going to put another ACT. Whoops, I forgot to. Like I said, when you put in an ACT, if you just type in the number, it will come up. So hit reset first to get it to 0, and then as you're typing the number in, it won't come up. And 120. Now we can start the ACT. I mean, if you just want it to come up, you can just type it in that way. And hopefully that'll be baseline. And again, when we pull up the blood gas, it should be also what we have entered into the scenario mode. And this is the last segment of the training video series, Routine Cardiopulmonary Bypass. This is part 4.